Hello, welcome back to my vlog series. This is vlog number 8, Theories About Health. So the theory that I decided to choose today is patient-centered communication. So the theory of patient-centered communication states that healthcare providers and patients shape their relationship through communication. It also kind of explains that better communication leads to more positive health outcomes. So that includes compliance to treatment and recommendations by healthcare providers and mental health at appointments, pain management, all those sort of factors are impacted by the type of communication that a patient has with their healthcare provider. I chose this theory because it's something that I feel like we can all relate to on some level, going to a doctor's appointment and maybe not having the best communication with a healthcare provider. And that really does take a toll on the effectiveness of an appointment. So I wanted to choose this theory as a way for me to understand why communication between a patient and a doctor is so important. I do think this theory is extremely useful. It's one that you can apply to all aspects of life, whether your appointment is at a doctor's office, a chiropractor, a dentist. The ideas behind patient-centered communication should be taken into account in all of those situations. So there's definitely a lot of utility to it, a lot of consistency across the board in terms of what patient-centered communication looks like. However, there are differences between what patients need in terms of their communication from their healthcare provider. So you definitely have to look at what is going to be most effective for your specific patient that you're looking at. I think some research that could be done on this topic could be to take a group of doctors or healthcare providers and give half of them a training course on patient-centered communication, and then don't give that same training course to the other group, and then kind of assess their patients and what they think about their doctors' communication styles, if they think it's effective or maybe what they could work on, and see how those results differ between the group that got the training and the group that did not. I know there's so much distrust within the healthcare industry and with medicine, so I think something else that could be interesting to research would be what qualities in a healthcare provider would make people most likely to take the advice of a doctor or to be open to the treatment that they recommend. So our wrap up for this week, today we talked all about patient-centered communication, which is a theory about health communication. This theory basically means that effective communication between a healthcare provider and a patient will lead to better health outcomes. It's also important for a healthcare provider to understand the full extent of a patient's history in order to best assess their health and their status. So this is a really good theory because it's very practical and it's one that is used so often, and you will kind of take these concepts with you for the rest of your life. So that's really important. But it's also important to remember that communication is different for everybody, and the communication that one person kind of desires in an appointment may not be the same as somebody else. So those are just some concepts that are good to keep in the back of your mind as you go to your next doctor's appointment. So I hope you learned a lot this week. Next week is going to be theories about culture, so that should be really interesting, and I hope you tune in. Thanks for watching.